Hi, and welcome to Healthcare IT Today. I'm Colin Hung, and today I'm joined by David Cohen, Chief Product and Technology Officer at Greenway Health. David, welcome to the program.
Thanks, Colin. Glad to be here.
It's great to have you. You and I have not seen each other in a while, and I miss seeing you at the conferences.
That's right. Yeah, we haven't been out to conferences in quite some time now.
It has been a strange year. And now you were just saying before we got on air, this is like your first time, you only been in the office a few times since March. So this is a very special occasion. Thank you for coming to the office.
Yeah, I've actually made an appearance in the office today. I think I'm the only one here, but sometimes you need a little escape from the kids, right?
Well, and you have a cool background too. So I have to compliment you on the background. It's very, very industrial look, but it's very modern. I love it. All right, David. So I was really excited actually to get together with you today because, Greenway, and we'll get to it in a minute, but Greenway has done some new things around revenue cycle which I want to ask you about. But this whole thing around revenue cycle in the last little while has just been, I'll call it confusing and challenging for a lot of providers. Because there's just been a lot of, I call them hammers, like we have a decrease in elective procedures, we have patients who are kind of foregoing care, we have mass unemployment and lack of coverage now. All this is hitting people at one time. What have you seen, and what's Greenway seen in terms of the challenges that people are facing around revenue cycle right now?
Yeah, absolutely, Colin. And a lot of our customers right now as well, they're focused on how they can traverse the pandemic, right? So having to put into place new clinical practices and procedures to better support their patient population. So some examples of that would be, seeing patients for COVID-like symptoms. We're getting into the vaccine now, which is also going to spur different types of payment and reimbursement. And then we've also seen an explosion in virtual care and virtual care type visits, including telehealth. And with all of that comes different payment rules and rules for reimbursement that our customers are having to traverse. And it certainly makes for a very complicated atmosphere right now.
And how have people navigated it? I mean, it must be so challenging for a practice owner or any healthcare organization to really get a handle on their revenues and what's coming in, because there's just so much happening.
Yeah, absolutely. And Greenway is really, we've been stepping up as best we can to provide that type of advisory service and consultation in working with our customers. And that's really my best advice for any healthcare organization, is to make sure that you have a trusted partner that can help you navigate some of the complexities here, because that's what Greenway does on a day in and day out basis. So for example, early in March, we were very quick to work with some of our partners to launch various best practices for our customers, including things like new visit templates, new billing codes for treatment, and making sure that our customers were able to get paid for their new encounter types. We've also been keeping up to date with various payer rules, ensuring that our practices are capturing the full revenue for the services that they perform. And then, I think we might get into it, but Greenway also recently launched a new revenue services offering that we are calling GRS Express. And that was really intended to help our customers navigate exactly what we're talking about here, to navigate and traverse some of the complexities of RCM. So GRS Express is a very rapid 2-week implementation cycle, but we're able to get our customers up and running quickly and provide services to do things like charge posting, claim submission, rejection management, payment posting, and help our customers make sure that they're getting paid and collecting right now.
David, I know there's probably a multitude of things that you've encountered, but is there sort of one or two that really stand out in this revenue cycle world that people are struggling with right now and really need the help? Is it these new codes? Is it the new visit types? Or was there anything that stood out for you?
Yeah, I think one example that we've seen is related to telehealth visits as an example. So telehealth, as you know, the complexities around telehealth are immense, and that would include everything from licensure. And I know there's a lot going on there right now around licensure packs across state and conversations about how that's going to work. But then, once you actually get into telehealth, then you have complexities around how you can actually get paid and reimbursed for those visits. And that's something that many of our customers have struggled with, and we're helping them to navigate that. If you look ahead, for example, into 2021, the CMS Medicare payment rules were just published and finalized this week, and they've expanded quite a bit there in terms of their Category 1 reimbursements for various telehealth visits. So those are kind of the permanent expansion of eligible telehealth encounters. But then also when you get into some of what they're calling Category 3 now, and that really is an extension of the telehealth encounters that were introduced during the public health emergency, that they've now extended for an additional year under the new provider fee schedule. So there's obviously a lot happening there that we're paying very close attention to make sure that our customers are able to get reimbursed for those types of encounters.
Yes, in the rush to implement telehealth, which has been a savior for a lot of places, of course, we've created a back-end problem of the billing and the revenue. And I'm glad to hear that you're helping folks figure that out, because it's become part of the business now.
Right, exactly. And it's still, it's obviously still a question, a concern from the industry, is how billing is going to continue to support those types of encounters.
So let me ask you this, because I feel I have to. There's sort of this belief maybe that the sky is falling for most providers in terms of a massive massive in the revenues, patients not being able to pay. Is that really happening out there, or is it a little bit more muted than what's sort of being sensationally reported?
Yeah, I mean, that's not, what we're seeing, at least within our revenue services business. And again, I think that may come down, Colin, to making sure that practices have the right partner to help them navigate that. That said, there's certainly, there's certain validity, I'll say, to some of the challenges that the industry has, in terms of figuring out value-based care and how those different payment constructs are going to float forward.
Okay. Well, you mentioned it a couple of times, David. Let's maybe explore it. What are, you mentioned, finding a good partner is one of the most important things that an organization can do to help navigate this revenue cycle challenge. What are some of the other things that you would recommend to someone to really kind of go, hey, like, do these few things and you'll put yourself in a good place when it comes to RCM?
Yeah, so one of the things, and I'll talk a little bit about where Greenway is focused on, and that's on making sure that you have a very good perspective and understanding of what I'll call your core revenue cycle KPIs look like. So things like your, days in AR, what your denial rates look like, and make sure you have a good understanding and handle on how those KPIs are trending and what actions that you're taking within your organization to impact and drive those KPIs. So, that's one of the services that Greenway offers. And when you think about where we're investing right now, we're investing in ensuring that we have a very robust data and analytics platform that will be able to support our customers' data needs into the future. Because I think, a lot of it comes down to understanding where you're at as an organization, and then, traversing that forward.
Okay. And you mentioned it a bit ago around your new, was that GRS?
Yeah,
service?
GRS, I'm sorry, yeah, Greenway Revenue Services.
Okay.
So that is our revenue services business that we have within Greenway.
And you said, so it sounded like it was a very rapid implementation. Can you maybe walk us through, like, why are people contracting with you for this service, and then kind of what's the result that they're hoping to get, or what you've achieved for them once it's been implemented?
Yeah, so again, our GRS Express offering is our latest offering, which is a rapid 2-week implementation process, and it's designed intentionally to provide that immediate relief and improve timely revenue collection. So
Okay.
this offering is focused primarily on helping our customers to improve collections.
Okay.
That said, we offer a full battery of revenue services offerings for our customers, everything from a very comprehensive type offering to GRS Express, Revenue Service Express, which is intended to supplement our customers' revenue services operations.
All right. So when you say you help them with collections, what are some of the things that package, that Express package includes? Is it templates and things? And
well, no, it includes the services, so the revenue services, the back office services to provide things like charge posting, claim submission and reconciliation, rejection management, and payment posting services. Everything that we do on the front end, Colin, so everything that we provide from a visit template to encounter template to billing codes, all of that is included free of charge for our Greenway customers as part of their EHR and practice management product.
Gotcha. So these are the actual services behind the scenes
That's right.
that you're offering. Okay, great.
Yeah. Yeah, and we've been very timely with the with the encounter templates, visit codes, because those things are changing, on a weekly basis, and we're pushing those out very aggressively to our customers.
And what's the feedback been around your GRS Express? I mean, how have your customers reacted to that new service?
Yeah, it's been very positive for the customers that contracted with us for that needed that immediate revenue collection relief. I think they found it very helpful for their organization, and many of those customers have then upgraded to the other services that we offer within our revenue services umbrella.
So let's look ahead a little bit, David. We spent some time talking about the current situation and looking ahead now. At least it seems like a post-COVID world. What are you seeing that people are not paying enough attention to in terms of what's coming down the pipe? Because I know we're all focused on COVID, as we should be, but are you seeing sort of another headwind kind of after that maybe people are ignoring right now?
So I think there's two things that we've hit on. So one is this focus on, at least where Greenway's focused right now is on data and analytics, because part of that again is really understanding and having a good foundational understanding of core revenue cycle KPIs and how they're trending. So Greenway, we announced in July that we partnered with Amazon Web Services and we have a collaboration there now to build out a robust data analytics platform that will have a heavy focus on revenue cycle insights. Additionally, it will give us easy access to some of the machine learning capabilities on the AWS platform, because a lot of what the industry has been focused on is understanding current state data and analytics. But now we need to take that one step further and start to look at, okay, how am I going to be trending, and what is my cash flow going to look like a week from now, 2 weeks to now, and how can I manage my organization around that? So we're investing fairly significantly in that data analytics platform so that we can provide some of the more advanced data analytics capabilities. And then additionally, I think making sure that, look, the complexities around payment rules aren't going away. So I think understanding those different complexities across payer organizations, because we talked about the Medicare physician fee schedule, but the reality is that every payer has different billing rules and requirements, and it's really important that practices and provider organizations are staying abreast of what the different rules are for different payers. And I think also staying on top of their patients, Colin. So understanding various patient financial situations is also really important for our customers. A lot of patients are have lost their job, and understanding any financial or medical hardships that their patients might have, and responding to that.
No, all very good points, and I totally agree with you in terms of payment complexity is not going away, despite our best wishes for that. So getting a handle and certainly having a partner to help with that is going to be pretty critical going forward. Is there anything else that maybe you're working on that you care to share with our audience in terms of new services or new exciting things happening to Greenway in general? Maybe RCM or even beyond RCM?
So we did launch, you may be aware, but we did launch our telehealth product several months ago, and that was really, intentional to support our customers to see patients virtually. But I think one of the things that we're focused on is that expansion of what the virtual care actually looks like for provider organizations, right? Because many, telehealth up until COVID was the most talked about, least adopted thing in healthcare, right? And then we saw an explosion in telehealth, and suddenly many practices were caught, I would say, kind of flat-footed there. But there's a reality, that many people in the industry believe telehealth is here to stay, and that introduces then a whole bunch of new complexities, right? Of how do I really fully manage a patient when they're not physically present in the four walls of our practice. So we're starting to look at, other opportunities within the virtual care space, things like remote patient monitoring that I think, is really on the fringe or on the cusp of seeing an explosion in the industry. I think it's something that's a really exciting opportunity in terms of how are we going to virtually manage patient health. And look, Colin, that's something that the industry has been really excited about for a long time, right? Which is patients taking ownership of their own health. And I think to the extent care organizations can support that with virtual care services, it plays right into what patients want as well, right? Which is, how can I manage my own health at home or on the go without actually having to go in to see a provider? So we get excited about that. And then, how do you supplement some of those things? How do you support virtual care with clinical decision support and chronic condition management and virtual care type capabilities? Those are kind of things that I'm excited about when I look ahead.
Well, I'm right there with you. I definitely hope that telehealth becomes a positive legacy of COVID, in the sense of the door is open now. People realize on both the provider and the patient side, hey, this isn't as bad. It's actually pretty convenient. It does not lead to any deterioration in the quality of care. I mean, obviously you can't do an examination via tele, but it does satisfy a lot of different types of visits where I now don't have to come in, and that's super convenient, let alone the decrease in costs, right?
Right, exactly. And what, another thing interesting about that is that in the past year, we've seen so many practices pick up, anything off the shelf that can, support a telehealth type visit. And I think, we're seeing practices start to realize a lot of the limitations of some of those products. And Greenway, we're focused on how can we integrate a telehealth visit seamlessly into a provider and a practice's workflow. So everything from scheduling, so how does a patient self-schedule their telehealth visit, to then how does that visit fit very seamlessly into provider workflow, from doing their chart review to doing their documentation for those types of encounters. We want to make that as easy as possible for the provider and also the patient who's on the other side of that visit.
You're absolutely right. And then, now we're getting into things like, what's a virtual waiting room look like? What are the screenings that you should ask someone while making that appointment to determine whether or not a virtual appointment actually would work, right?
That's great.
Because
That's
the
right.
last thing you'd want is to have an appointment scheduled, and the first thing you talk and you realize, oh, you probably shouldn't have come in for this one.
Yeah,
But
and that's a great point, and we are seeing practices start to think very strategically about that. So, thinking about which visit types are best suited for a telehealth type visit or encounter, and being intentional about how telehealth is going to fit into their practice.
yes, the only thing I would say is I wouldn't want to be in the real estate business right now, because I think doctors' offices are definitely going to shrink in 2021 and beyond. But we could spend all day talking about that. So let me ask you this final question, David. What's one thing that you want people to take away from our conversation today? What's the one point you go, if you listen to nothing else, you take nothing else away, take this one thing away? What is that, David?
Well, I think the one thing I would say is, again, going back to making sure that practices have a trusted partner in revenue cycle management, because as we talked about, the complexities aren't going away, and what we really want at Greenway and try to support with our Greenway Revenue Services, to make sure that our customers can focus on what they do best, which is providing clinical patient care and making sure that we can take care of the revenue cycle back office for them.
And David, where can people find out more information about Greenway and everything you've just spoken about?
Well, obviously they can go to greenwayhealth.com.
Awesome. David, always a pleasure to speak with you. Thank you for taking time out of your day to educate me and educate our audience on some revenue cycle challenges and the things you're doing at Greenway. Really appreciate it.
Thanks, Colin. It was good to speak with you.
This has been Colin Hung at Healthcare IT Today. Thanks for listening.